Good morning. Sorry, it took me a second to figure out the controls. Really good to be here, and great to join everybody for this event. I'm always excited, extra excited when I'm speaking to people in the people and culture HR and OD profession. So I'm going to use the broadest set of descriptors because even that doesn't do it justice. There's just so much incredible work that the profession does, and I'm hugely proud and privileged to work in the profession and to lead the profession for the NHS. There are 16,000 HR and OD professionals in the NHS. It's the largest HR function in the world, and it's the best HR function in the world. And we will take more steps to strengthen that in the coming years. Every event that I'm speaking at right now, I start with sharing that I haven't recovered yet, but I've had a horrendous bout of COVID despite being double jabbed, and that it's taken a lot out of me actually, and I just want to urge everybody to take their booster shot and to take. Well, if I'm hoping and assuming that everybody in the people profession is double jabbed already, and it's time for a booster, and we've seen the guidance from Amanda Pritchard and JCVI for all of us to take our booster very soon. So please do, because the clinicians who I work with said, seeing my symptoms, that if I hadn't been vaccinated, I would have been in hospital or worse. And that just, so I'm taking it upon myself to, personally tell everybody I speak to, please get your jabs. And not only you, but your colleagues, your communities, your families. So having said that, I just want to get right into what we are here to discuss. And it's really exciting. It's an exciting and challenging time. And I think it's not one or the other. So it's been an incredibly challenging 18 months for us all. And and the NHS has further challenges ahead. But what has been incredibly positive and the silver lining through the challenging 18 months is how we have all responded to the pandemic. None of us were trained for this scale of challenge, but each of us has responded to it in a way that has made a huge difference to patients and to our communities. And the people profession in particular has had such a key role to play in shaping the response to the pandemic, and equally has a key role to play in shaping the future. So when I arrived in the NHS, which is now coming up to 3 years, believe it or not, so in March it'll be 3 years, I could immediately see the power and impact of the people professionals across the service. And as I said, I feel incredibly proud to lead the profession of at least 16,000 people. And we are a service business. So the most important role that any of us has is actually people management, people support. And, we are lucky that 100% of our job is to do that. So last week, as you know, we officially launched the Future of NHS HR and OD report. This has been just a very powerful example of co-creation, of doing something important through actually engagement with literally thousands of people, engagement with all of our key stakeholders, whether that's staff, patients, people professionals, all of us, chief execs, service leaders at every level, the government, all of our kind of collaborative and partnership bodies, academics, the HPMA, NHS employers, the staff side representatives, universities, CIPD. It's just been the broadest look at two things that I was keen that we are situating our work in. One is, what is the future of healthcare? And the second is, what is the future of work? Because these two elements are going to determine what our role is and what contribution we can make to that. So what are the two or three aspects that have shaped this work? One is the future of healthcare is much more with patient empowerment. And actually, that leads and reflects directly into the future of work, which is about people empowerment. And I know empowerment is too broad a word, but what it means is each of us treated as individuals and with dignity, respect in the work that we have to do, and that of course covers a lot of aspects, whether it's the people promise, whether it's digital technology enabling each of us to be engaged in in a much more positive way, um, whether it's equality, inclusion, equity, so that those 8 recommendations or 8 themes that are in the report really speak to the future, where the future of healthcare is going and where the future of work is going. And in fact, the future of work is not going in that direction. It's already here. And what I've heard from the profession over the last sort of 8 months that we have been working on the report is that we are ready and in many cases are already meeting that future. So, for example, I was in a trust a couple of weeks ago where every ward has a QR code for staff to give feedback about the shift, to give feedback about how they're feeling, to give immediate feedback on what can be improved, which is just so brilliant. It's such an open way to to listen to staff and then to do something about it. I was absolutely blown away by that. So that to me is the bringing together of technology, bringing together of staff engagement, and really in real time responding to what people need to be able to provide good care to patients. So that's just one example of where our role as people professionals is going. So, as clinical models of care, as models of, as patient pathways change, and so much transformation has already happened during the pandemic, ways of working have changed, and all of you have played such a huge role in making that happen. What I'm seeing now is that need for transformation is ever greater. So if we look at the demand for healthcare and the supply for healthcare, these graphs do not meet. There's a huge capacity gap. So this and this. And then with the pandemic, the need for healthcare actually increased even more and supply went up, but not enough. That gap doesn't close in any country and never has. So the question is, what actually will close that gap? And it's transformation of healthcare, transformation of what the patient role is in this, using prevention as one of the key levers for managing the demand for healthcare. And our role as people professionals is to enable leaders, it's to enable teams to be able to meet that transformation opportunity and challenge. And that's what the Futures report includes as well. I just want to check on time. I have a few other things I want to share, but is there how much time do I have to speak? Is there going to be some time for a couple of questions? Can I just ask that? Okay, I'm not hearing. Um, okay, thank you, Nikki. That's really kind. So I have until 10. Got it. So I'll share some more thoughts. It's really important for me to hear what is on your mind, and so I can either take it away for further reflection or share my thoughts right now. So I'll keep some time for Q&A. So there are, kind of 8 themes that we have, that you have said, and our stakeholders have said are important. The number one is actually prioritizing the health and well-being of all of our people. And again, wonderful examples. One of the things about the People Plan and the Futures Report is that all of our intentions, our plans, our actions that we are suggesting and we're collectively signing up for, they're happening already somewhere in the NHS. That's the good thing. So we're not saying, well, somewhere over there or in Google or in the US, this is happening. This is already happening somewhere in the NHS, but it's not happening everywhere and it's not happening every day. So it's about scaling the good practices that we know with evidence already work. So prioritizing the health and well-being of our people, and I've seen incredible examples of this. I saw a really wonderful rooftop garden in one of the trusts, which was with some areas for quiet reflection, stepping out of intense clinical areas. And the fact that the National Health and Wellbeing Offer has been accessed more than 1.2 million times shows that we are prioritizing the health and well-being of all of our people. I would just add, also prioritize your own health and well-being. That's very hard to do. We find it easier to prioritize other people's health and well-being, especially in our profession, but also for many health and care professionals. But I would say look at what you need for your health and well-being as well, because people professionals, and I know from my more operational parts of my careers, that we absorb a lot of the stress from the environment, we absorb stress from other people, and we get involved with quite difficult and intense situations between people. So yeah, prioritize your health and well-being as well. And the second theme is about creating a great employee experience. And then the example I've just shared about real-time feedback about what makes for a productive shift. How do we have really sharply targeted interventions, so that we're really listening to people and then addressing what gets in the way of people doing their work. Retention is our key priority, and all of these 8 themes actually point to how we can retain people who are in the health service, how we can enable people to stay and stay well. The third theme is ensuring inclusion and belonging for all. And this is something that is particularly I think there's two roles in an organization where there's the maximum impact on equity, inclusion, and belonging. One is the chief exec of the organization. The buck stops with them. And the second is actually the chief people officer and their team, because we as people professionals have such an outsized impact on people practices and on how we ensure that everybody's voice is heard, that we're de-biasing our processes, where we are being honest and brave about things that need to be called out and changed. We have a really important conscience keeper role in that area. So that's about it, ensuring inclusion and belonging for all. The next one is supporting and developing the people profession, which I'm very excited about. I've done this previously in my career, and it's just one of the most rewarding things that I've been involved in. So we will be looking at standards, we'll be looking at investment in developing skills. And I would just like to point out that 70% of development happens on the job. So that's important. It's by doing. And how can we be intentional about our development as we do our challenging jobs? And if I may offer a suggestion that I try to do, not always successfully, but I do try to do it, is creating a bit of reflection time individually with my line manager and with my team, saying what went well, what would go even better if. And I know we all do this in different areas, but try to do that for your own development. How did that go? What is my development goal for the next 6 months? And I always like to be practical about it, because 70% of development happens on the job. 20% happens with coaching, mentoring, and peers, actually. So it doesn't have to be a formal mentoring relationship. You can, ask someone, well, I'm going to do these difficult presentations or presentation over the next few months. Would you help me do it more effectively? So yeah, this for me is very exciting. As you can see, I'm very passionate about supporting and developing the people profession. The next theme is harnessing the talent of all of our people. And this is, for me, so important, because we have just the most incredible people within the NHS. And I've worked in 3 sectors: the private sector, the multilateral development sector with the United Nations, and now in the healthcare sector. And I've worked across many, many countries. And I can tell you that the talent within the NHS at all levels is, is first of all, equal to the best in the world, and in some cases better than that. And the reason is that we have such a unique healthcare service. There's a reason that we are one of the very few, if not the only country with true universal healthcare, because it is a very difficult thing to deliver. So the people who are delivering this with the constraints and the complexities, they are extremely skilled. Healthcare is the most regulated industry in the world, and we have very talented people who are working in it, including the group I'm speaking to right now. So harnessing the talent of all of our people is a very important important theme that we all are already involved in, and we will amplify that. There are three themes left: leading, improvement, change, and innovation. And I spoke about that gap that we have. Supply will do this much, and the rest of it has to really be, has to be completed or enhanced by improvement, change, and innovation. And if we look at how the service has changed and improved and transformed in the last 18 months, we know that you all have played such an important role in making that happen. How can we create a culture where that is the way things happen, where people feel confident that they will be supported, where the patient and community and health outcomes is driving that change and innovation? So I really want the profession to be, around the table at every discussion that's talking about change and improvement in clinical care, because who's going to make those changes and improvements? It is people, and that's where we come in. The penultimate theme is embedding digitally enabled solutions. And here I was just giving you an example of one of the trusts with the feedback on the phone with a QR code. They also had every process, every HR process on mobile, so mobile, enabled, which for people who are in shifts, have busy lives, we are all using that technology for our life admin. It's really important that we keep up and help people, help people have those solutions at work as well. It's not an easy area. For some of the solutions, it requires funding. For some solutions, we can do that within the envelope that we have. The last one is enabling new ways of working and planning for the future. And this is, we become much more future focused, because anything we do in people, it requires time, right? If we are going to talk about leadership development, if we're going to talk about managerial skills, it does take time. And therefore, the more future focused we can be, and always a challenge, right? To deliver for today, deliver for tomorrow, and plan for the day after. That is a leadership challenge and a leadership skill. So as a profession, we will become and focus on both delivering really, good outcomes today, but also building blocks for the future, whether that's supply of workforce, whether that's the culture change that we need to enable people to do their best. All of those elements will determine what, how the future of the NHS is sustainable. Okay, so I'm going to stop speaking now. We have about 12 minutes for Q&A. I'm wondering okay, there's the answer to my question.
Here I am. Thank you so much, Prerana. Absolutely inspiring, as always. As somebody's put in the chat box, when we hear you speak, you give us a sense of hope and that there's some light on the horizon. So thank you so much. Thank you. Also, there's a lot of wishes for a continued recovery, and thank you so much for coming today when you haven't been feeling well, and hope your health continues to improve. We've got a couple of questions coming in, if that's okay, and the first one is from Rachel Andrew of the Goodley Group. The engagement and conversations for the future plan have been fantastic, and they've got us together, and they're adding to the conversations our profession. This work has got us talking about ourselves and our profession and being interested in ourselves. How do we keep this going at all levels, building peer-to-peer support together?
That's such a great question, and it's on my mind as well. So thank you for that question. I would say that the way we're thinking about implementation, it's going to be as engaging and as open and transparent a conversation as it was to create it together with you, which means it's a learning approach. It's not assure us that this is happening. No, it's about how is it going, what's going well, what can we learn from each other. And we have these learnings from the people plan delivery approach that we've been using, which is about, well, it's kind of the improvement cycle, and that is what we will use here. So the focus will be on how everybody can lift the work that we're doing, and we will use the same sort of both technology and engagement opportunities to do that. I feel very energized when I'm talking to people. I get ideas, and I know others feel the same way. We'll continue to have the kind of governance we had. So we had a CEO advisory group, we have an HRD advisory group, and they have just been, really, we have a steering committee, and all of them have said that they are absolutely committed to staying involved in implementation. So, very exciting plans for keeping all of us connected as we go through this journey.
Thank you. And you've talked a lot about digital enablement and sort of really harnessing the opportunities that advances in tech are bringing. Is there an overarching strategy for this? This is a question from David Jones.
Great question. And there is not yet an overarching strategy, but there is a small team of people who are thinking about it and starting to create that strategy. And that's across the Department of Health, it's across HEE, my team, and NHS X and D. It is quite like with anything in the NHS, it has to be both local. So there are some things that can be and best done at a local level, whether that's employer, ward, and now system level, and a few things, just a few, that have to be done at the national level. So it kind of needs to come together and dock in, which is part of the implementation plan for sure. I want to add to this that we also need a skills plan, not just for our profession, but actually for the NHS, which is, what are the 70-20-10, the more intentional we can be about that 70%, the better. We rely heavily on the 10% formal training, but we actually not ignore, but we're not making as much of the 70% as we could. And the same thing applies to digital. So as we're doing our work, what is going to help us make this, make this frictionless and get the benefits from the digital world that we are living in. So yes, there's a strategy being worked on at early stages. The digital space is quite fragmented, and one of our key first tasks, is to bring the right people around the table.
Thank you. And somebody's asked, I think in reference to you talking about our need to continue to recruit and retain staff in an ever-challenging national and global market, what would you say is the best approach that we could take to attract new people to people professions in the NHS? So attract people into our own professions as well as trying to bring people in across all the others.
That's such a great question. So I am amazed that people don't know how incredible the people job role is in the NHS. People outside the NHS don't know that. So one of our collective responsibilities is to talk about the profession, is to write articles for trade magazines, for HR magazines, where other HR professionals are present. It's Mamta has said advertise outside of NHS jobs. Totally agree, completely agree, Mamta. And we are starting to do that. And I would say that in systems now, there is a big opportunity to do that because people work and live locally, most of the time. So if you are in a place, reaching out to a network of HR professionals in, let's say, the Greater Manchester area, that would help people understand what these roles are. And each of us has both an opportunity and a responsibility to share just how incredible this job is and what we contribute.
Thank you. Mum to Dund has asked for your advice, saying that they're relatively new to the NHS, and their reflection is that they're seeing a lot of reactionary and transactional activity in the people profession, perhaps due to the extraordinary times we're in. But they're saying, how do we create that time and that space that you talked about earlier to reflect and think in a more strategic, planned way? And they've asked for your advice, if you have any on that, please.
Mamta, that's such a tough question, and something that I try to balance on a daily basis, and sometimes succeed and sometimes don't. So I can only share my efforts. As I said, this is a challenge for every leader. How to, if we look at Amanda, for instance, as the chief exec, she has to see what's happening with urgent and emergency care today. What is going to be the plan for winter, so the next 5 months, and what is the plan for the next 3 years, and even have some, and there's a long-term plan for the next 10 years. So leaders at all levels are managing, and it's really challenging this difficulty. So when I think about the role that I have and other people professionals have, we have to make sure that what is required today to keep the operation running is being delivered. And the more we can protocolize it, so transactions, like you say, we do need to carve out a bit of time to step back, get some data and evidence. So queries, for instance, let's say you have lots and lots of queries from employees. What are the 5 themes that people are always asking about? So we with transactions, sometimes we treat the symptom. I made a healthcare example there, where we treat the symptom instead of going to the root cause. And transactions can be managed. We can have an improvement cycle, and actually, the HROD team in NHS EI with Helen Bullers has been doing that. And so the example I'm sharing is, again, it's happening somewhere. And I know all of you are doing that. But think about what are the symptoms, what are the root causes, and then you have to carve out some space. It's a little bit like we keep putting band-aids on things that actually we just need to take a day out and structure that day in a particular way. And in some ways, from a psychological perspective, we have to break the loop that we are in, where we are doing similar things every day, and I mean myself as well. And it's so hard to break that loop in our mind. So I would say we have time. If we repeat to ourselves, we have time, because otherwise the message we have is we have no time. We have no time to think. We have no time to do things differently. We have no time to engage people, to overcome resistance. But if we switch that to, so I believe in affirmations a lot. If we say I have time and plan for that time, just let's not give ourselves the option of saying, oh, I can't do any planning. So I have found it is about what I'm prioritizing, what I attach value to. And so it's a little bit deeper than, saying, okay, I need to manage my diary. It's really, what am I valuing? Am I valuing activity? Am I valuing feeling that for a day I didn't produce activity, but actually I sat with the right people around the table and did some thinking, had some difficult conversations about what we're going to stop. And that, I think this applies not only to the people profession, it applies to all of the NHS, especially when we are responding to a pandemic. Sorry, that was a bit of a rambling answer.
Fantastic, thank you. One last question, if I may. Is the NHS ready for us? Do our organisations know what's going to hit them?
Oh, they are ready, absolutely. And look, this is not a revolution. It's an intentional evolution. That's how I would describe it. So this is not about, we're not going to break things. We're going to say, these are our strengths, which we have put in the report. This is what we're building on. And let's be intentional about our evolution. So we're working back from where we want to be in 5 years' time or 2030. And working back means that we are going to take our stakeholders with us. And, there's always a normal curve, isn't there? So there are some organizations, some people, some leaders who are ahead of us, and they're waiting for us to catch up. They're saying, well, why isn't the people profession playing this role? Then there's the folks in the middle who are saying, well, if you create value for staff and you help me deliver healthcare in a better way, that's great. So, have at it. And then there will be a small percentage of people who feel uncomfortable with change and feel like, well, I don't really know how this is going to turn out. So what if it goes wrong? What if, and with those leaders and people, we'll have to do a bit more work to engage and take them along on this journey. But I'm absolutely confident that when they see the value, there will absolutely be no issue with that. I mean, who would argue with I can solve your problems faster or better, or provide solutions that you didn't even think of. Yeah, no, so I'm not saying it's easy, but I think we might find that people are much more open to this change than we think.
Yeah, and that builds on what you said earlier around this is already happening in organisations up and down the country. We're seeing fantastic work being done. We're seeing, amazing innovation. And what we want to do is spread that and share that and do that consistently. So thank you very much. Prerana, thank you so much for joining us today. It's been an absolutely fantastic time to spend a bit of time with you talking about the future of HR and OD. Nikki has very kindly put a link to the report in the chat box. So if people haven't got that yet, so can pick it up there. But once again,
can I say what?
Yes,
First of all, it's the pleasure is absolutely mine. It's so great, and I'm going to read the questions. I'll go off video and then read the questions so I can see what other things are on people's mind. My call out would be, take the report in your team and create your plan for that report as part of the implementation, and then take it to your exec team and say, so I'm kind of threading a few of the questions that came up. How do we keep the implementation going? How do we take leaders with us, etc.? So create an implementation plan. Use the same principles that we use nationally for the report, in the sense of co-creating that implementation plan with your stakeholders, with your union representatives, with execs. Take it to your exec, get them to sign off. That's what I did. I took it to the board of NHS. I took it to the exec. So much support. They were excited about it, actually. So, use the same model, and then let's keep going. Thank you.
Thank you so much. Thank you. And do go into the chat. There's some great messages for you there as well.
Thank you.